Good afternoon, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. And today we are honored by great guest all the way from UK. Let's welcome Steve. How are you, sir?
Hello, how are you?
Okay, great. Okay, so Steve is from UK and he is really doing great job with his podcasting on by the name of Crossroads, right?
Yeah. I've got a podcast called Crossroads Podcast UK.
Okay, very good, very good. So we're gonna ask you a little bit about that and kind of go from there. So tell us about yourself, sir. What do you do normally?
Well, I'm kind of locked in at the moment at home, but I'm a television, radio, and also I am obesity campaigner because I've suffered with obesity and mental health myself. I
Mhm,
know what it's like when people are going through it. So
mhm.
what I do is I do support groups.
Okay, very good, very good. And I think we'll ask you first your journey about being a podcaster and in the media. How did when did it start and how did it start?
Well, last with the media, it's this happened quite a long time ago, in 2015,
Hmm.
when we did a program called Two Back to Work. It was on a Channel Five. It was on Channel Five over here in the UK. Then I was all in the media. And then I was on national television.
Hmm.
Then I started doing campaigning about stopping takeaways and near schools because by law that that takeaways or fast food outlets are not allowed near schools because of childhood obesity.
Hmm. Hmm. Yeah, and I think it's very important that we need to have a support group. We need to have discussion. I mean, like you are doing an amazing job by putting this out on the media, on and a lot of people. First of all, kind of give you a lot of courage doing that. That's a phenomenal work. Not everybody can do that. So kudos to you. Great job you're doing. So keep it up. So I'd like to ask you. I think I have seen some of your podcasts. You do a lot of mental health issues, right?
Yes, we do. Yeah. When I was when I came back from boot camp in 2015, I suffered with mental health. I committed suicide,
Hmm.
um, and I kind of was down. I was depressed,
Hmm.
and then I tried jumping off a bridge. Tried kind of like hanging myself, etc.
Hmm. Hmm. Yeah. So first of all, again, great to be able to share that with all of us that you tried to commit suicide, and then now you're trying to help a lot of people to raise the awareness about first mental health, number two, and also about severe depression and suicidal ideation. So we're gonna ask you a little bit on that. So tell me, what have you seen? What makes it worse? I know with pandemic going on is not helping anyone. So do you think that is really bringing on a lot of stress in a lot of people?
Well, the trouble is we're stuck in our homes altogether at the moment. Here in the UK, we're like families, and and we're all stuck in.
Mm-hmm.
And some of our homes are so small we can't just go into one room or
Mm-hmm.
to the other. So we're stuck together. We don't know what to do.
Mm-hmm.
We're arguing, and some relationships split up. There's been an irate in divorce
Mm-hmm.
lately because of the lockdown. Um, so yeah, so and mental health really.
Mm-hmm.
There's I was talking to somebody the other day, and mental health because of the lockdown actually gone up at iron rates. So there's a lot of people committed suicide over COVID.
is true, and a lot of people is kind of bringing a lot of unfortunate divorces, stress. I have seen a report about a lot of kids. They have hard time dealing with it because their schools are closed and they don't like online learning. So that's very hard, very tough because they really miss their friends, they miss their teacher. There's the relationship between teacher and students that is being affected. So a lot of things are happening, and that is sad, but I guess we have to make best use of the time and what we have resources.
Yeah, back in July last year,
Mm,
I um, I started like doing my podcast
mhm,
live like this, and it was mainly to help people who were lonely or on their own, or people who had mental health issues.
mhm,
Then it grew and grew and grew, and because of that, I kind of like now I just kind of like my podcast. It's everywhere. It goes everywhere to anybody.
mhm,
And what's good with our podcast is this: that we have we got we do it 7 days a week,
mhm,
and on our podcast we have different guests.
mhm,
It could be doctors, nurses, it could be celebrities, it could be anybody from life, in general.
mhm,
And what we do is like if people who are suffering with depression or mental health and they need help, we have counselors on the side where they can kind of like phone up one of the counselors and get help.
mhm, mhm, mhm. And that is actually amazing job you're doing, and keep it up because not too many people are doing that kind of work. So it's very important that we kind of get encouragement from a lot of our similar podcasts. Our podcast and our TV channel is Lifestyle. We encourage and we support anybody who's doing great work, and then I try to get them as many shows on it. So mental health is an important topic.
Yeah.
Over the years I've of course seen a lot of patients, and mm, one thing I like to, every case is unique, and so every story is unique also, and I like to learn from your side. What made your depression worse? Would you
Well,
like to
what it was, I when I was younger, having, I went into different relationships,
share? Uh-huh.
so I was attached to people. So and I was a sort of person who could fall in love so quick with people.
Mhm,
So every time when somebody left me,
mhm,
I went for attention.
mhm,
But after a while, I got depressed, got really down, and I remember one time where I was actually sectioned on the section 21 of the Mental Health Act,
mhm,
and they sectioned me for about 2 weeks into a psychiatric hospital because I had um, really, really, really bad depression.
mhm. Yeah. So, and what are the things you find um, helpful? So, what are things?
Well, I think the trouble is, I think men now they should really kind of like talk. We should talk because a long time ago, men never used to talk a lot. Ladies or women, they can kind of like, they're easy to talk to.
Yeah.
My wife, she can talk for England if
Mhm,
she had the chance to.
mhm,
And that's some women for you. But men sometimes they tend to hide their feelings and they don't want to talk. So
mhm,
what I've done now is on my podcast, I've also got like a kind of like a mental health support group
mhm,
where we're coming together weekly and we're talking, where people can come on our support group
mhm.
live and we can talk about issues, our own issues and everything.
So, and that is a good point that men don't talk as much as women talk, and one way of them expressing or getting some therapy is because they have friends and they talk, which is good. So I wish we had support group and we could talk our things out. And it's difficult to get things out from men. When I see patients and I ask men, are you sad or depressed? They say no, no. They deny it. But if I ask them further, give them time, and then they say, "I'm mad." You know.
Yeah, yeah.
So the only thing I'll get out is saying, "I'm mad. I'm upset."
The trouble is, though, what you've got to realize with depression is that uh, I ain't got nothing against the doctor, so.
Mhm,
But the trouble is, the doctor can only prescribe you. They don't know what you're going through, actually going through underneath.
mhm,
It's like a plaster. It's like you kind of like you got this sore on your hand and you're putting a plaster there. And us men sometimes put the plaster there, but we don't want to take it off because we don't want people to know what's under the surface.
Yeah, yeah. Many times, it's hard to even know, and there are layers, or we have to kind of sit and let it out.
Yeah, yeah.
So, support group. You're holding that meeting every week, or how is it
Yeah,
work?
so what we do is we have a meeting every week on our support group.
Mhm,
Um, Anybody can join. We get people from all different walks of life, doctors, we get nurses on there. Because don't forget, doctors have been going through quite a bit as well through
uh,
all the COVID.
yeah, yeah.
They've been working their socks off,
Mhm,
and they've been doing a good job. And so what they do is they come on and they usually rant and say like, this is what's happening
mhm,
and things like that. And it's a time where they can kind of like speak out where there's no judgment or and we can have a chat as men do.
mhm, mhm. So tell me if you like to share some of the things or which you have seen in support group, which you can share for audience sake. What helps to share.
Well, I think personally, I think what you need to do is um you you need to admit that you have a problem.
Mhm,
So if you, it could be like for we get people who is alcoholic, we get people who is on drugs, and so or and mental illness, and what we do is we try to encourage people to talk about these things, about this stuff. The trouble is, though, there's a lot of stigma out there at the moment
mhm,
towards things, especially like obesity
mhm,
and disability and stuff like that. So but we be careful. So what they do is they come online, they just talk, and it might take them a few weeks to really open up to us, or months.
mhm,
I've had somebody who was really, really kind of like suicidal, and they kind of joined our group. We talked to them, you know, um, and we kind of, you know, we just kind of say to them like, we know what you're going through because we've been there.
mhm, mhm. And that is important, that you're right, there could be many stigmas. I mean, it could be stigma about appearance, it could be stigma about being harassed, bullied, or being like you said, being overweight, or they don't see that as a problem, or they don't want to share, they don't have a strength to share yet. But
Mm.
once they see other people opening up, it could be me or it could be anybody opening up in the support group and kind of giving their story, then they feel that, oh, maybe I have that kind of problem. If that person has a strength to share, maybe I can also share, speak few words. And
Mm.
I think that is a great thing which I see in support groups. When people who have similar problem, the unfortunate outcome is very similar, because in terms of mood disorder, so we all get depressed, whether it's whatever is the reason, right? It could be any trauma, it
Mm.
could be anything. So when we look at, so there, a couple of things happen. Of course, circumstances or cases could be, stories could be different, could be unique. But you remember, if we are sad or depressed, that state has couple of symptoms or some of things which it resembles everyone. So you could have lack of motivation, you could have lack of sleep, you could have lack of proper eating, and you could be either overeating or undereating, both. And people could have guilty feeling, or they could have suicidal ideation, or all of the above, right?
Mm.
So if we have that, so once we talk a little bit about awareness, and we talk about a little bit of the symptoms, then people can relate. Yes, oh yes, my story could be different, but I share the same thoughts, or I share the same symptoms. Then they probably click, and then they might want to share more. Then they understand, what is depression, and a lot of people I see, they can be depressed, but they consider that a new norm. They'll go into this cocoon, or into this state where they think this is the new normal, and they detach from the reality. They're detached from the older, better person when they were, right, when they were not depressed.
Yeah. Yeah.
And that's easy to slide into that, because as humans, we kind of try to compromise with the bad situation
Yeah.
by
Yeah.
just withdrawn response. So we are withdrawn, we are not doing things which we were doing before. But unfortunately, that kind of complicates further, because we are sitting and not moving at all. That makes your mood disorder worse. So because then becomes what we call psychomotor retardation, or people are sitting on couch for hours, or uh, they are sitting and not doing anything. So so that, it's a cycle. We have to break that cycle. We have to give positive energy. We have to get them help, with counseling, with medication, whatever it takes, to get them
Mm.
out. So also like to emphasize, what things have you found was helpful in your situation when you were suicidal?
Well, the trouble is when you're suicidal, you lose control.
Okay.
Number one, so you don't think what's going to happen the following day. What you're thinking about is that you want to kill yourself.
Mm-hmm.
So that's one thing. But in my situation, it was kind of like my faith.
Mm-hmm.
And I was. Can you imagine it when you're on the edge of a bridge and you're about to jump and you can hear a voice,
Mm-hmm.
and a voice can come to you and say, "Look, Steve, I love you," and and you're looking around and you're thinking, who's this guy, telling me he loves me,
Mm-hmm.
and and because I've got a Christian faith,
Mhm, mhm,
I I believe that God was telling me, that He loves me and He doesn't want me. It's not my time,
mhm,
and I can come out of it. And the
mhm,
trouble is, so when you make that decision to come out of it,
mhm,
also you got to make sure that you you do things the right way. By if a doctor gives you a tablet, it gives you
mhm,
medication, take the
mhm,
medication.
mhm,
If they offer you help, take the help. If anybody's listening now is going through a bad time at the moment,
mhm.
all I can say to you is this: that suicidal ending your life is not. It's a no. It's a no
That's
no. There's
mhm,
people out there who can talk to you,
mhm,
and if you can't speak to doctor here, you can always contact me, and we have people right now who could actually talk to you. It's no, it's we we people who will kind of like actually will sit there, who will talk to you over the phone and say to you, what the problem is, and these people have been through every single thing. So it
mm,
could be like drugs, could be alcohol, could be
mm,
mental health, it could be anything.
mm.
But getting back to your question, the trouble is when I went to a psychiatric unit, I had to, I looked at other people and I'm thinking, no, I don't want to be here. They're all mad, I don't want to be here. But they wasn't mad. What they were human beings.
Wow.
Human beings who
Mm,
actually need a little bit of help,
yeah.
right? And
Mm,
we've got to put a stigma behind that on mental health because we cannot do that. We cannot label people. We've got to stop it.
mm,
Stop labeling people. We've got to kind of like say, look, this, these people are people. These are human beings and they need to be treated properly.
mm. Yeah, yeah, that is true. So now the human emotions are very complex. So, there could be, but I think there's one thing for sure: positivity, encouragement, and those go a long way. So if we encourage somebody to talk, and if we support them, no matter what, being not judgmental, that goes long way.
Of course
In
it
your
does. Yeah.
yeah, yeah. And so I think you're doing amazing job with support group. I'm sure you guys kind of help each other. And like you said, if they can't find a doctor, they can call you or talk to somebody who would listen rather than doing things which would be a wrong thing to do. And your life, because we all get one life to live, and then if we kind of throw it, then in my opinion that is not the greatest mind to think. I know it's hard at that time, very hard to make that decision, but we are here, you're here,
Yeah.
we are
See,
here.
in the past, sorry, in
Yeah,
the
go.
past, in the past, I've seen people, and I put you into. I will tell you something. A while back, years ago now, I remember having a knife to my throat, right? Because life was bad. I lost my pet. I lost my mum. My
Hmm.
mum just died. I had a lot of pressure on me, and I thought the only way out is just kind of like ending my life too, because I wanted to, because she was gone. I wanted to go to. All right. And the
Yeah.
trouble is grief. People say, oh, grief is kind of like a shock system. It is.
Yeah.
It is a shock because there and then, when someone dies, especially a loved one, you know, there is automatically a shock that you never experience in your old. It's totally different what you experience. And with me, when I wanted to put a knife to my throat,
Mm-hmm.
right,
Hmm.
I wanted to end it.
Yeah.
But the trouble is, also, I was also saying, you know, somebody hurry up and help me. And this is why I do my podcast. I don't do my podcast to get all the figures and all the people to join my podcast. I do my podcast one for people to kind of listen, two to actually kind of say, yeah, I'm going to get help.
Hmm.
And that's what we are all about. We're trying to help people. We're not trying to make any money from it or any royalties or anything else like that. Or about us, we just like to help people. And that's why we're called Crossroads, because at a certain point in our life, even your point as a doctor, mental health could happen to anybody,
Yeah.
right? And
Mhm.
when we reach that crossroads in our life,
Mhm.
we confusion comes in and we don't know which way to turn, right? You can go either left, you can either go right, or go straight on.
Mhm.
But if we stop in the middle and say to ourselves, look, this is what I'm going to do. You know, I want to kind of like improve my life.
Mhm.
Forget about what's in the past. Let's move forward.
Mhm. Yeah, and I would again, congratulate on running such a beautiful and such a great work you're doing, Crossroad. giving an avenue and without any looking for any money or any sponsorship or anything. May it be great if people support, but we are here to support you all, to make sure, make a difference, listen to you and help you all. I think if we make a change to somebody, one person's life, I feel very honored. I mean, I personally, I feel very honored that, one person calls and say, you know, but listening to your podcast or listening to your story or listening to your words helped me to make a better decision, whether it's mental health, whether it is lifestyle. We are all here for all those people. So,
I'll tell you what. I'll tell you what. Before I go, I'll tell you something now.
mhm.
We have we put sent 16 people to rehab.
Wow.
Right? We've
Mm,
sent 16 people to rehab. That's alcohol, drugs. Right? We have sent only four people to a kind of like a safety house
mhm,
because they were being beaten, domestic violence. We also sent quite a lot of people to get help for mental health. That could be like the organization called Mind,
mhm,
or it could be psychiatric help, or it could be listening, the group,
mhm,
or it could be all other organizations. That's what we do. Now, we every time when we got to pay something out for our stream
mhm.
or something like that, I come to a point where am I going to get all this help? I don't ask for it, but all of a sudden, out of the blue, someone comes along and says, "Oh, you need help this month. You need some money to pay for this. Let me pay for it."
Wow. Very good. Very nice. Very nice.
And that's how we do it. And that's how we do it.
Mhm.
And we raise money for mental health too.
Okay.
And that's the way we do it.
Okay. Well, any final thoughts, Steve, would you like to share with my audience?
Yes. Look, at the end of the day, COVID is a big, big thing. But what we can realize is that as we go through COVID, the situation, if you're at home at the moment and you're just feeling down, depressed, and you need somebody to talk to, then just contact us. Podcast, Crossroads Podcast UK. Contact us, and we will give you all the help we can possibly. You know, do not suffer in silence. Do not do that
Mhm.
because if you suffer in silence and you continue doing that, then you will go down to a spiral into a pit. And when you're in that pit, it's so difficult to get back out again. So so all I can say to you is this at the moment. If you're suffering anything, if you're thinking that, there is no way out, and you want to give up on life at the moment because you're afraid to get COVID and you're afraid that it's going to kill you, things like that, I can tell you this now. Just stop and think and get help straight away.
Okay. Well, thank you for this beautiful message and straight to the heart. So I would again encourage if somebody is suicidal or thinking of ending their life, please do not do that and get help. In US, you can call 911 or suicide prevention hotline. Get help. It is very important that you take care from professionals who know how to deal with it and how to take care, and they'll get you out from there. And also in UK and everywhere else in the world, get professional help. Do not end your life, and do not be afraid of just virus. There can be many things which could be difficult at one time or the other in your life, but remember, we will overcome and you will too. We are all together. We're all here to help. Steve is there. I'm here. We're all going to help each other and make a difference. Thank you for watching our show. Take care. Thank you.